Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Emmy Kool-Aid-Nylander, and I'm thrilled you're here. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. The podcast was born from a shared truth. Healing isn't just about medicine, it's about connection, listening, and leadership. And who better to lead those conversations than women physicians? The information shared on Healing with Her is intended for educational and information purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice and guidance of your physician or other qualified healthcare provider with any questions you may have. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institutions or employers. So let's meet the panel.
Hi, I'm Dr. Jolie Sosa, OBGYN.
Hi, I'm Dr. Melissa Neal, board-certified ophthalmologist.
I'm Pamela Reed. I'm an internist.
And as I said, I'm Dr. Emmy Kool-Aid-Nylander, an OBGYN. So, you ever wonder who's who when it comes to eye care? What's the difference between an ophthalmologist and an optometrist? Dr. Neal.
Okay, so, the difference between, I'll tell the similarities. I'll start with the similarities. So we both handle eye care, but ophthalmologists, we've gone to 4 years of college, 4 years of medical school, and then also did 4 years of residency. And people who have specialized in retina or cornea, they've also did additional training. So when we talk about an optometrist, I like to think of them as kind of if they're more dealing with vision and general eye health. So they've normally done 4 years of college and then did 4 years of optometry school. Yeah.
So when do you go get your eyes checked? How early does it start?
Well, it should start when babies are born. They are all kind of checked for vision to make sure that you can't really check if they're seeing, but you can kind of check to see that the eyes have been developed properly. So really between ages from birth to about 6 months, a child should have their eyes examined. Then again, you should have your eyes, checked around. Like some people, if you notice that your child's eyes aren't straight or they're wandering or something like that, you might get them examined sooner. But between 6 months to about school age, so when they first go to kindergarten, they should have an eye exam to make sure they're able to see as far as they need to see for the board and things like that. Then the AMA, the American Academy of Ophthalmology, recommends that people get their eyes examined about 2 times in the 20th decade, so your second decade, and then around 30, you should get your eyes examined about 3 times in that decade, and then when you're 40, every 2 or 3 years, you should have your eyes examined. And those guidelines are really based on if you don't have a family history of eye disease, or if you don't have diabetes, you don't have a family history of glaucoma, things like that. So those are general guidelines based on healthy individuals without a family history.
So, Dr. Neal, are the children who are getting their eyes examined, is that being done by their pediatrician?
So it is being done by their pediatrician. So it could be done by the pediatrician. It could be done by a pediatric ophthalmologist, although, they tend to be quite busy. But most of the time, it can be done by, a pediatrician or a pediatric. pediatric ophthalmologist. Yeah, or a school screening. You know, sometimes people will say, they'll go to the school nurse and they'll try to read, and they're like, I can't see that, and then they'll get sent to an ophthalmologist or an optometrist for further screening. Yes.
Yeah, I've been wearing glasses since the 4th grade, and it was mainly because I could not see that board.
Yes.
So what I first started doing is just moving my seat closer to the chalkboard. And then at some point, I'm like sitting in front of the television. It's right like this in front of me. So it was at that point that my parents were like, I think she needs
Yes.
And now I see much younger kids wearing glasses. So it's really good that people are recognizing that young people are having a difficulty with their vision and addressing it early.
Exactly, and there's been some research that the more that you read, the more that you use kind of devices up close, television, those kind of things, and since our world has moved to more computers, more digital, that trend that you're seeing more younger people wearing glasses, that's going to be more common. Yes.
So what about the blue?
The blue
light
glasses.
glasses.
I mean, people feel that it decreases eye strain. I, as an ophthalmologist, I'm like, I don't really advocate for that. I think there's not a lot of science behind it. But if you feel that, that it helps you in terms of eye comfort and things like that, then I will tell my patients, go ahead and do it. But I don't really recommend it per se as a treatment. Yeah.
So back to those of us who are on screens all day long, how do we preserve our eye health if you have to be on a computer at work? You may come home and you choose to read on your iPad.
Yeah.
Should we only do that continuously for a certain amount of time? Should we take breaks? What would you recommend?
Yes, so it's funny that you asked that because that gets into the realm of dry eye. So that's kind of my specialty is dry eye. But what they recommend is actually after being on a screen for about 20 minutes. So they recommend that it's called the 20-20-20 rule. So after 20 minutes, you need to look in the distance, like about 20 feet, for about 20 seconds and give your eyes a rest. Yes. So. And what some people do is they set a little timer, because what happens is when you're reading, you tend not to blink as much. And so a lot of times I'm seeing, people younger and younger having dry eye and issues with eye comfort. So it's not like losing vision, but it's the quality of your life and the dryness of the eye. And so, because when you're reading, you tend not to blink as much, will get dry eye. So that's why they want you to do that 20-20-20 rule.
So what symptoms do you have with dry eye? Is it like a scratchy, itchy?
It's a whole bunch of different things. So you can have redness. You can just have, some people have difficulty where they're wearing their contact lenses and they get contact lens intolerance. After you're reading for a while or using the computer, your screen gets blurry. The tiredness that you describe, at the end of the day, your eyes may hurt. It's a lot of those symptoms.
So does simple like eye drops, lubricating drops, does that help it? Or is there degrees of dry eye?
There's definitely degrees of dry eye. So what I advocate is for people to try to really limit the use of your eyes, not in a way like using them in a way that they're meant to be used for. So, when we're out there getting saber-toothed tigers, we're more hunters and gatherers. We're not looking at the screen. But when nowadays we're on our phones, we're on the computer, so really we're taxing the eyes a lot more than they're used to. So taking those breaks that you need to, and then also if they feel dry, using artificial tears. But if you're using artificial tears more than 2 or 3 times a day, you really need to see an eye care professional because the eyes are being taxed more than what's required. So, yeah.
So you make a good point. I'm an avid reader,
yes,
and I tend to read on a device. Granted, I no longer work on a device,
right,
so it's kind of a trade-off now. I guess I'm fine now.
Right.
But for those people who are always on screens, if you're a reader like me, then you're probably abdicating that we actually kind of go to print and or
Print and still taking a break, because even reading a book, like, you know, if you're just in that book and you're not blinking, you're creating an environment for your eyes that's creating inflammation, and inflammation over the time can cause, you know, scarring on the eye, buildup of the oil glands, and it really, dry eye is not it, like, you're not going to die from dry eye, but dry eye can be so bothersome. It can affect people, how they live. They feel like they can't enjoy things. Some people say they can't even go out with friends. Some people, when dry eye is very severe, have gotten suicidal from dry eye. So it's a pretty significant in terms of how you feel about the quality of your life, which is why I love treating it.
So on that line of thought,
Yes.
what eye symptoms should prompt you to go to the emergency room?
Okay, so or the emergency room, or seek an eye care professional, because I say not so much to the emergency room, because a lot of times they don't have ophthalmologists. They don't have an ophthalmologist on call. So if you go there, you know, they might not be able to, you know, diagnose what you need, and they're going to send you to the ophthalmologist the next day anyway. So anytime, like if you have sudden loss of vision, so even if it's for temporary loss of vision, you should definitely seek eye care help. Floaters, if you develop floaters, flashes of light, a shadow or curtain in your vision, that can be something, for example, like a retinal detachment. So you really need to see someone very soon, because if you do have a tear, it's easier to treat early on. Other things, eye pain, significant eye pain. Even if you don't lose vision, if all of a sudden you're like, I have really blurry vision in one eye, then you should definitely seek care. Or if you have a trauma, if you're poked in the eye, you get something in your eye, that is definitely a time that you should go see see someone. Even if you feel that you got it out, because a lot of times you might have a scratch. Sometimes people may maintain a little bit of a foreign body in the eye, and so that should be looked at.
Do you recommend like rinsing immediately after you have a foreign body that you think you got out?
Yes. I do recommend that you flush it out. You can use tap water, or if you have like sterile saline, that is very good. Also, you want to, and this is going to sound gross because other people, you might want to, when you're flushing it out, flip the lid, because a lot of times stuff hides underneath the lid, if you can do that. But yeah.
Are there protective things that you can do to help protect yourself when you're out and about in the world, you know?
Yeah.
Because I don't like dust in my eye. I'm like so sensitive. I can't even put contacts in. So.
Okay. You're like, you can't wear contacts?
I cannot wear
You can't
contacts.
do it?
Nope.
I only wore contacts, on my wedding day, and I was like, nope, my eyes were too dry. So yeah, but I mean, things that you can do to protect your eyes. I mean, one really good thing when you're out and about is wearing sunglasses, because the UV light, just like how it can get cancer on our skin, really it can cause you to have, more likely to get a cataract. It also can affect your retina. So I always recommend that people wear, protective eyewear. Just like we wear sunscreen, it's you can't put sunscreen in your eyes, so that kind of helps to protect the eye. I also recommend that I always advocate for safety glasses. I know people, you might be in your house and you're like, I'm just gonna go hammer something really quick, or I'm gonna just cut this piece really quick. Those are the injuries oftentimes that we see. People are like, I had my safety glasses on and I just had to cut one more thing, and then they get something in their eye. So I always recommend when you're using any kind of power tools or doing any kind of home improvement or anything, like even when you're mowing the lawn, wearing glasses, safety glasses to protect your eye, because there have been people who have lost their eye just because they were out mowing the lawn without safety glasses or without protective eyewear.
So you talked about kind of seeking like more immediate care for certain symptoms.
Right.
As an internist, who is it that you recommend that I send to you just for general eye health?
Okay.
So 2 parts to that. What symptoms should I be more concerned about if a patient presents that would say to me, I need to get you to see an eye health professional sooner rather than later?
Okay. So that's all. So we'll say we'll use things that aren't anatomic. So just symptom wise at first, and then I'll talk about the anatomic things. So, for example, if a patient comes in and says, okay, they have high blood pressure, and they're like, for about 2 or 3 minutes, I lost vision in one eye, but it came back and it's good now. I still would recommend that they see an ophthalmologist, because we can look for things like sometimes if they had like a plaque in the carotid that a little bit broke off and they lost vision, it can come back, but that might clue us in that we need to do something more for eye health. I mean, I know you know this, if somebody has diabetes, and it's very important that even when people are first diagnosed with diabetes, to get them in to be seen right away. And the reason being is in studies they found that 20% of patients already from diagnosis already had some type of retinopathy in their eyes. And there's a huge study that when you catch retinopathy, diabetic retinopathy early, you can prevent vision loss. So that's definitely, I would say, whether they're having symptoms or not, to get them right in.
I think this is something almost like I want to repeat it and put it in a speaker, because I feel like diabetes affects our community so often, and we think about the sugar itself, and people may think about maybe foot health, but they don't realize how much it can affect the eyes.
Right.
And what you just said about the fact that once you're diagnosed, 20% of people already have significant retinopathy, which means significant disease of the retina.
Right.
I think we need to highlight how important it is to get in, to have your blood sugars under control, to take whatever medications you need to take, and also have those lifestyle changes to really optimize not just your body elsewhere, your eye health, and all the other organs too.
Right.
Yeah.
Yeah.
Yeah, and to that point, even if you have well-controlled diabetes, like so sometimes patients will say, oh, my diabetes is really well controlled, so I don't need to see the podiatrist, or I don't need to see the ophthalmologist, which is a fallacy. You absolutely do, even if it's very well controlled.
Right. No, because the longer that, so even though it's well controlled, the longer that you have diabetes, the more likely it is that you can have, diabetic retinopathy. And it's not only, even though it might be, well, my diabetes is under control, there might be other conditions that I often will see in patients because they came for their diabetic eye exam. So that's another reason why even though it's under control and you may not have diabetic retinopathy, you may have cataracts, you might have glaucoma, you might have narrow angles, you might have like a tear that you didn't know about. So there's other reasons why you should go.
Yeah. My mom is diabetic and since her 30s, but
Okay.
always super well controlled.
Yeah.
And developed diabetic retinopathy despite that, and
Yeah.
lost the vision in her right eye.
Oh.
So
Yeah.
that's why
It's really
I'm like
important,
so particular about people going to get their eye exams done,
Right.
even if it's even if they have well-controlled diabetes.
Yeah.
I always love these conversations because as friends, we talk about everything other than medicine. But then you see, you marvel at how brilliant your friends are. And then you teach us so much too. So thank you.
You're welcome.
Yeah.
You're welcome.
So, what kind of supplements can we use for our eyes as we grow older? Like, what are some of the changes, age-related changes that we have with our eyes? And are there supplements that can help,
There, so there are certain supplements that can help, but they're mostly for, like people who have macular degeneration. So those have been proven. The main thing for eye health, wearing your safety glasses. I guess I harp on that.
what about carrots?
I mean,
That's what I was raised on. My mother said, "Eat your
everybody was.
carrots."
Everybody eat carrots for your eyes. So there is. So for people who have macular degeneration, age-related macular degeneration, what's in carrots, the vitamin A and things like that, those have been found to be very helpful. So if you are seen by your ophthalmologist, they diagnose, like, they're called drusen, which are little deposits in the back or changes in the macula. Those can be slowed down by taking, it's called the ARIDS 2. There was just an ARIDS, and then they did a whole nother study. It was about another 10 years, and they found that an ARIDS 2 formulation was more beneficial, and so that's what we're recommending. But it has, like, lutein and zeaxanthin. People have seen that. So if people want to take a multivitamin that has lutein in it, that can be protective, a little bit protective. But there's not studies on it. So, I always try to do evidence-based, but that is something that you can take. But wearing your sunglasses is just like wearing your sunscreen. That is going to prevent, the changes from the UV light from affecting the macula. Also, smoking. So if you have changes in the back of your eye, smoking increases the risk of having eye issues.
So smoking nicotine or smoking marijuana?
They haven't done any studies about marijuana. I just know about the nicotine. I just know about the nicotine. I guess we're in New York State, so you're like, what kind of smoking?
You have to differentiate.
Yes,
so.
Smoking cigarettes now, but I mean, you're still inhaling, so I don't know about the marijuana part.
Thank you for that.
Yes.
Do you have any anecdotes about any, like, patients you've had in the past that that kind of stuck with you?
Yes. So like we were talking about who should go and be seen. So I was a second year resident, and I was at the VA, and we're seeing people, and we have this gentleman come in, African American, very handsome, and he comes in and he's like, I'm like, okay, what was the reason you come to see me today? Well, he's like, I'm having trouble. I'm bumping into things. And we check his vision. His vision is 20/20. So he has perfect vision, doesn't wear glasses, never seen by an ophthalmologist. But then we check his pressure, and his pressure is 40. Okay, so for those of you who don't know, normal pressure is between 10 and 21 as long as you don't have glaucoma. And when we did a visual field test on this gentleman, he was actually walking around with 20/20 vision, but he was blind because he only had tunnel vision. So the way glaucoma works is it actually affects your peripheral vision and causes damage to the optic nerve. And that damage is very slow, so you don't know that you're losing vision until you're having difficulty. Some people, I've had patients tell me, I was walking down the hall and I had to feel walking down the hall, and I was like, oh, I need to get my eyes checked. Or this gentleman was bumping into things, and so he came in 20/20 vision, but was legally blind because of his visual field being so constricted.
So I should know this because I recently got my eyes checked.
Okay.
By the optometrist.
Which is okay.
Do the optometrists always check your pressure?
The optometrist does always check. They should. They should always check your pressure. Mm-hmm. Normally at an optometrist's office, they might use, basically, it's like a pneumatic where it's a puff of air.
The puffs.
The puff of air,
Yes.
which everybody goes, and they're like, they're like, wait a minute, are you going to puff my air? Puff my eye. And I'm like, no, I don't do that. So ophthalmologists, most of us use a Goldmann tonometry, which is the gold standard. So you get drops put in your eyes, and then we actually use a device to kind of check your pressure by slightly touching the eye, but we don't do the puff up. But pressure, your eyes pressure should be checked at every exam. That's important. Yes.
And I know you sort of mentioned before how often we should see an eye professional as we age. Mm-hmm. I find that everybody these days, people of my age range, are saying, and all of a sudden now I have to move my phone back and forth. What is that? What's happening when we have to start
when
doing
you do
that? Yeah, to read.
Yes, that's aging change. No,
How do we stop that?
How do we stop that? So the way you stop that is the fountain of youth. No, but yes. So we all when we're younger, we have an ability to accommodate. So accommodate means that when you get your vision check, so 20/20 means that what a normal person can see at 20 feet, you can see at 20 feet. So that's perfect vision. And then what your eyes have this ability, they have a muscle that squeezes really tight, and that allows you to take something from a far distance and bring it all the way up close. As we get older, just like some of you, you notice you're not as strong. Your muscle, you know, you may have pain in your knees, or, you know, me a little in the hip. So the eye does the same thing. It's basically just a weakening of that muscle or stiffening. And so because of that, and it all happens at different ages. So sometimes people can be like in their late 30s. Some people, you know, I've had patients that are like 55, 56. I'm like, you don't worry. They're like, nope, can see fine. And I'm like, okay. So everybody is different, but around 40, 45 is when you notice that. And it's just the ability where you can't bring that target, you can't add power into your eye anymore. So, and that's why we have to get reading glasses. So
That's interesting.
Yes.
So I've been noticing, and I do get my eyes checked. Should you get your eyes checked every 2 years if you wear glasses?
I mean, if you wear contact lenses in New York State, you have to get your eyes checked once a year because that's required by law. But
I did
if you
not know that.
Yes, if you wear glasses, you might want to get them, you know, every 2 or 3 years, depending. Some people want a new pair every year.
That's me. I'm not
So there you go. That's right.
That accessory.
That's right.
It's an accessory. I think we're all accessorizing.
Yeah.
I have to join the club.
But I have noticed that I need to increase the brightness on my devices and on my screens because it's just not bright enough for me.
Right.
I've brought lights over. I've put the thing up to 100%. And it's sometimes still not bright enough. What is that?
So that is most likely a little bit of cataract.
Say
So-
what now?
Yeah, I have it too. So I want everybody to know if your doctor tells you have cataract, don't be like, oh my gosh, I have to do something about it. All a cataract is yellowing of your natural lens. So we all, like in our 40s, 50s, 60s, you all will get a little bit of a cataract. You only have to worry about getting the cataract out when you start to have symptoms. The main symptom of cataract, decreased vision, you know, glare when you're driving at night. The colors may not be as sharp, needing more light, but that is related to a cataract. The other thing it could be related to is also a little bit of dryness because although, you know, we have a lens in our eye, your tear water interface does about 2/3 of your seeing. So if that is not stable, you might need more light. There's more scattering. You get glare. So it could be dryness since you say you're on the computer a lot.
I'm learning so much from you today.
I know.
I love all of these aging conditions, right? All right. So, you know, first it's that vision. You have to like start reading
The
glasses.
day I started that, I was mortified. I'm like, how? How has this come already?
I turned 40 recently. And I started.
too.
Exactly. I started going
Happy birthday
with
to me.
my medicine bottle, and I'm like, whoa.
Yeah.
What? I mean, it happened overnight. I was like, that was scary to me.
I feel almost overnight. One
Yeah.
day you wake up, I'm like,
What is happening?
okay, maybe
Yeah.
it's allergies.
Right,
Let me get some eye drops for my allergies. Took a nap, wake up, maybe I didn't sleep enough. Still doing it.
Yes.
Yeah.
It is overnight. And it's
Oh, wow.
overnight because your body will adjust until you fall off a cliff.
Wow.
That's what it's like. Because when you can see, and then once you can't, you're off the cliff.
Interesting.
So I tell all my patients that they're like, it happened overnight, and it does,
Wow.
and I tell them that's
good to
just
know.
how it
Yeah.
does.
That's amazing.
So my aging issue, because I'm not 40.
Right.
Um,
You are 30.
Thank you. Is I developed floaters all of a sudden, just one day floaters, right? And so, you know, being the doctor that I am, I'm going to worst case scenario, you know, this is a retinal detachment. Exactly. See someone immediately. But of course it was not. It had to do with the vitreous.
That's right.
Right? Because of my age.
That it too is a aging change.
What's the vitreous?
So the vitreous happens to be, it's a gel, like a jelly or jello that's inside your eye, and it's really adherent to the retina. And as we get older, it liquefies, and then at between, probably about 80% of people, by the time they get 80, it will pull away.
And I am not 80.
I know. I said, by the time. It can happen all the way in the interim. But
Nothing against 80-year-olds.
yes,
No.
yes. But that is something, if you, just like how you thought worst case scenario, just like you were like, I need to go see my ophthalmologist or optometrist. If you develop floaters, even though it's a normal aging change, you should be checked.
Just to check.
Well, Dr. Neal,
Yes.
any last words of wisdom about eye care that you can give us?
Besides, wear your sunglasses, safety glasses, because those are, the main things. And since dry eye is, a very common condition, the 20-20-20. So after 20 seconds, look in the distance.
Minutes, yeah.
Give your eyes a 20-second of rest. And, if you, the other thing, since about 25% of people in the United States have diabetes, if you're diagnosed with diabetes, please, get your eyes examined and go yearly, like your primary care doctor recommends, because, it could save your vision and, keep you seeing for years to come.
Thank you very much. That brings us to the end of our episode of Healing with Her. We hope you found the information enlightening and empowering. Please subscribe to our podcast on YouTube, follow and like us on Instagram, and share with everyone you know. The information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are their own and do not necessarily reflect those of their institution or employers. Thank you. Thanks, ladies.
Yes.